The Clinical Enhancement Module for Youth Mental Health is an online learning program for GPs, developed collaboratively by RAC GP and Headspace. The learning is delivered through video interviews with expert clinicians and young people, as well as video case studies. The module also includes interactive questionnaires and feedback.
I have done the Youth Mental Health ALM and found it fantastic. I think the format is great. It's actually really interactive and there's case studies and you get feedback. It's all evidence-based. It's a really well put together package that I didn't find a chore to do at all.
It covers off on all the important concepts that are quite generic in how to engage young people and assess them for risk, that are fantastic in a culturally sensitive way and in a trauma-informed way. It even does some scenarios with Aboriginal and Torres Strait Islander young people and clinicians that are experienced working with them.
So for people who perhaps are new to working in the realm where they're dealing with young people, or for GP registrars also, the Youth Mental Health ALM is great because it actually covers the whole breadth of issues that young people will be dealing with.
I'm an experienced clinician in this area, but it reinforced the theory, the way the evidence is informing practice, and also gave me some other useful tools that I don't commonly use I found really interesting. I also would recommend it to any person working with young people. So if you're a clinician, particularly in school settings, as we're seeing is becoming more common now, if you're working in other clinical settings with youth, even if you're in the education field and you're in a counselling role with young people, I think these are really valuable learning resources.
There's a vast array of links and resources that a busy GP will be able to have on their desktop and save. So they've got those resources there when they're faced with a young person who's dealing with, often very complicated issues. And if you're working particularly in a rural setting where you may not have access to a Headspace or another, close by youth mental health service, being able to access those resources easily and having that background information from doing the ALM will be really valuable to the patients.
The learning outcomes for this module include identifying ways to improve the engagement of young people, including the discussion of confidentiality to improve treatment adherence and long-term treatment success, catering for young people from diverse backgrounds, including the need for culturally appropriate care for Aboriginal and Torres Strait Islander young people, and effective engagement techniques for young people who identify as LGBTIQ, and implementing appropriate mental health screening tools to help formulate evidence-based care plans for young people and recognise the impact a mental health disorder diagnosis may have on a young person. This ALM is worth 40 Category 1 accreditation points for the RACGP and 30 points for the ACRRM, QI and CPD programs. Furthermore, this ALM forms a clinical enhancement module which can be used to obtain mental health skills training when combined with an online mental health skills training core module. You can find the Youth Mental Health module and all of its resources at headspace.org.au/GP.